I hope that all of you have found these conversations as energizing and so thought-provoking as I have. They've really been amazing. And they've all been focused in one way or another, taking different maybe angles and perspectives on what insights we can glean from a look at the what of systems transformation. And it's been exciting to see how many of the participants and the questions from both the moderators and the commissioners that show deep agreement with different tactics that efforts to protect both climate and health can be deeply interconnected, and that they should be deeply interconnected, that they will have outsized impact by doing so. But we've also heard the case that focusing most productively on this nexus requires bold cross-sectoral action. And I thought it was particularly heartening to hear from yesterday's sector-specific panel, the second session we had, that a cross-sectoral effort would be beneficial to their work, that they don't see that happening generally, and that they really agree that it would have an accelerator effect on impact. So it feels that the roadmap effort is on the right track, at least in trying to bring those sectors together as we engage in laying this out. I think the discussions have been very useful in surfacing many of the persistent structural and institutional barriers, especially those that often keep efforts siloed, whether it's financing or a variety of other domains that keep them separate, whether intentionally or unintentionally. But we've agreed that many of the challenges, and we've seen that in their discussion, that many of the challenges faced in transforming each sector in ways that promote health really are clearly shared. We also heard great recommendations in all of the sessions on what could move the needle forward towards systems transformation. We've heard over and over again discussions about developing the right metrics. We've heard over and over again that significant new kinds of narratives and other communication strategies would be useful, ones that would resonate more strongly than technical evidence, both with the general public and also with policymakers. And finally, we've heard that framing health for each of the different sectors in ways that would be most relevant would be useful. And it doesn't mean that they're in competition, but that the language and the immediate outcomes rather than the long-term impact might be different as we go along these pathways, that for some, it would be through the lens of operational and workforce risk. For others, it would be promoting the economic or productivity value. For others, it might be societal well-being. And all of those we heard would be useful, but they may be differentially useful for the different sectors. But laying it out this way is really a perfect segue to the next panel, because this session that we're about to embark on invites us actually to push the conversation even a step further, to explore how reframing health itself can unlock new motives and new ways of working across perceived boundaries. So we're going to explore what actually has been touched on lightly these 2 days. But we're going to explore it deeply, and that is the hypothesis that health is not only one of the clearest and most compelling outcomes of effective climate action, but that it can serve as a strategic driver that aligns diverse sectors and motivates systems-level change. To help ground this discussion, we'll be drawing on 3 complementary frameworks. Each provides a model for organizing society and its priorities: the well-being economy, care societies, and resilience. Each of these offers a somewhat different lens, but collectively and most excitingly, they invite us to rethink what we value, how we measure progress, what progress is, and whose knowledge and needs must be included in the transition to a more sustainable, equitable, and healthier future. These are really interesting concepts. And so we thought that many of you would look to have a deeper dive into these concepts than having sort of 3-minute intros from each of our speakers. So we've included a dedicated section in the participant briefing book that you can download from the event page. And I hope you've had a chance to really take a close look at that. But the goal of the discussion today is to explore how these three frameworks reimagine the role of health in systems change, and to offer actionable insights for their integration into climate and development strategies. And we have a terrific group of panelists to help us do that. First, we have Anita Chandra, who's Vice President and Director of RAND's Social and Economic Wellbeing Division, where she leads efforts to align social, economic, and infrastructure systems towards healthier and more equitable communities. Next, we have Fatimah Kelleher, a Pan-African feminist political economist, an international women's rights advocate, and a member of the NAWI collective, who brings over 2 decades of experience advancing care-centered, equitable approaches to health, to economic justice, and to sustainable development across the global South. And rounding out the panel is Alaa Murabit, a global leader in health equity, sustainable development, and resilience. She serves as a UN Sustainable Development Goal advocate and a UN high-level commissioner on health, employment, and economic growth. In addition, she currently holds the role of Sustainable Growth Advisor at the venture fund and seed accelerator 500 Global. We'll begin with a moderated discussion among our panelists and then Q&A. So feel free to start as you hear the conversation, feeding your questions into the chat. So let's lay the groundwork, and maybe I can ask each of you how these frameworks, the framework of care societies, of well-being economy, and resilience, both challenge traditional definitions and conceptualizations of health, but also could help in shifting health from a sectoral goal to a systems level imperative that could drive climate resilience, economic sustainability, and social well-being. So who would like to take that first? Let me call on, it probably is easier for you. Let me start by calling on Anita.
Great. Thanks, Judith. And I apologize if some folks aren't seeing my video feed. It's on from my perspective, but we are trying to sort it. As long as you can hear me, that's great. First, I wanted to applaud the commissioners in this whole conversation by thinking about health as a way and an entry point into the conversation about climate, and also thinking about these other frameworks. Let me start with a note of caution and then answering Judith's question directly. So one thing that I think deserves repeating and underscoring is certainly where we are in the conversation in the health sector, which gives opportunity to the climate conversation, but also a very realistic appraisal of the barriers. So, of course, health is conceptualized differently across global contexts and in different societies based by community and population. But health as an entry point in many places is not as salient as entry point as we might think, having done this work a lot in communities. One of the issues that came up yesterday in the conversation was this idea of the conflation of health and healthcare. Of course, that's more acute in the US than it may be in other settings, but even this issue of how we think about medical and social care is a challenge point. And so as we think about connecting health as an entry point into climate, that does pose a challenge and hopefully an opportunity. We've talked a lot about expanding the definition of health, and this is where the well-being framework comes into play. we've talked about health as more than just the absence of disease and the complete understanding of mental, spiritual, emotional, physical, and social health since the WHO definition more than 75 years ago. But the question is that really hasn't taken root in many of our models. We actually haven't moved to a health production model, an assets-based model that is moved away from that kind of notion of health as morbidity-based and disease-based. That poses a challenge for health reform, both in the US, but really globally. But it also poses a challenge to this question of how do we then convince people to think about narrative co-benefits in terms of health and climate. So that's one of the reasons, actually, why the well-being framework has been something that those of us who work in kind of traditional health, health promotion, public health, healthcare, have really grabbed onto that conversation, because it gives an entry point when often in community conversations, we've talked about governance, when the public health department or the health ministry or the mayor's initiative on health is a afterthought, is often not considered in the conversation. So well-being has provided an entry point to think holistically about health in some ways, but the broader conceptualization around purpose and meaning, thriving and flourishing, but without the baggage at times of health. And we have to be honest, I think, about some of those challenges. The other thing that well-being provides is a way to think systemically, because in order to get to the point of considering the assets that you must put into place in community and society, reimagining systems and structures has to be a part of that. And it's a continuous process. It's not a static process, which many of sometimes our sector solutions, whether health or in some of these other areas, doesn't afford. So we've spent a lot of time in communities trying to advance these kinds of frameworks, which we can talk a little bit more specifically throughout the conversation. But it has provided us a new entry point and a way to disrupt the health paradigm, actually, that has been in its own way challenged over the last 75 or so years. I just wanted to kind of name those challenge points before we go on.
That's excellent. Thank you so much. Very, very helpful. Fatimah, maybe next to you.
Off mute there. Thank you so much, Judith. And again, yes, I think this is a fantastic conversation to be having, and one that, as a political economist in particular, I find not as many spaces to actually have them as often. You know, finding these intersections is, you know, the push for much of my work as a feminist political economist in particular. And one of the things that has come up consistently within our work, within care societies, is the importance of the care economy. And so for much of what I do, I look at what the care economy means in terms of delivering on care societies. Now, care societies place equity and justice at their heart. But in order to move to a care society, you would need to recognize in the first instance the inherent structural inequality that exists within societies. But the focus would not just be on inclusivity or reaching, you know, the most vulnerable or marginalized, but also a redistributive approach, which in many ways will actually disrupt and upend structural inequalities at their root. And as such, care societies are both communally focused, but also have a very strong collectivist underpinning more broadly across that society. So it's not just about moving away from a compartmentalization of health. Forgive me, I'm a bit sniffly today. But also about moving away from placing, how can I put it, the onus of health on individuals and other atomized groupings like the family. And I'll probably come back to that later on in the conversation when we get to the discussion on narratives. But essentially, care needs to be placed at the center of economies for this to work. So again, recognizing in the first instance that it is, you know, that care is largely unpaid or underpaid, largely delivered by women, and is an unsung and undervalued foundation of our societies and our economies, and the maintenance and the health of our societies, which our economies are dependent upon. So, you know, they are essentially the core social reproduction of those very societies. So people, workers, the maintenance of social bonds, you know, the reproduction of the very institutions we rely on, from education to water to transportation. And when it comes to the linkage with the environment and human health, this is absolutely critical for care societies. And this is why care societies and the well-being economy and well-being societies are so complementary, because it's always a people and planet approach. Otherwise, very simply, it will not work. So this is recognition of the linkages which take us not only away from health, again, being siloed, but takes us away from atomizing the onus of responsibility on individuals, but it also creates a holistic framework that aims to ensure that good health is there, not just at a palliative point of entry, but also at a preventative point of entry. So a very classic example of that, particularly in my role working in macroeconomics in the agricultural space, for example, is the issue of non-communicable diseases. So NCDs, as we know, are rising everywhere, like clockwork on the back of urbanization and modernity, industrialization. And a care society would need to take, let's take an example here, elder care, where NCDs are very prevalent, as a major part of its framework. But this would be futile if we were only looking at it from a palliative position. And so here, those linkages with the environment are critical, not just because a major cause of NCDs is pollution from emissions, but also because of the role that commercialized agriculture has played in the modern diets that have also been proven to be contributors to the rise of NCDs. So we have seen green revolutions across what, today we consider the developed world, high-income countries, cause a huge loss in biodiversity on the one hand, which is part of the cycle of climate degradation more broadly, but also deliver a loss in nutrition within food baskets, especially amongst the poorest. And so here, increased access to sugar, rising obesity levels, and all the rest of it. And so a care society would not just be concerned with the redistribution of care and what that means in terms of equality and equity between men, women, and different sectors of society, but would also be critically engaged with the importance of understanding how our macroeconomic decision-making, including what the implications are for environmental sustainability and environmental degradation, link into how we maintain healthy societies more broadly. And I'll stop there because I'm sure there's a lot more to come.
Great. Thank you so much. That was very helpful. Now, resilience is a somewhat different concept, and I have spent, as some of you know, when I led the Rockefeller Foundation, a lot of time thinking about resilience and how it applies here. And so, Alaa, tell us how you see it and why you think it's so important, really as a central narrative concept and an outcome for the kinds of issues we're discussing.
Thanks, Judith. I think resilience in most of the contexts that I've worked in isn't just a strategy. It is a survival mechanism. It's a necessity. Fatimah and Anita had both spoken about kind of community-led work and the ecosystem of work. I mean, if you look at women-led cooperatives, for example, in the Sahel or in most of your fragile and post-conflict and conflict countries, they're improving food security, maternal health, climate resilience simultaneously. They're really managing and reimagining those systems from the ground up, often because, to Fatimah's earlier point, the existing systems didn't necessarily see them. And so I see resilience as not simply a response to current dynamics, but really reimagining the systems around you. Now, I started my first organization, the Voice of Libyan Women, when I was 21 during the Libyan Revolution. And one of the key things we considered, or the questions we asked, were what are people's current belief systems that we're asking them to shift? Why? What are their needs or the stories they believe about themselves that would create some sort of resistance to this? And what are the positive things we could influence to shift that? Now, at the time I was in my last year, I had just finished medical school. I was in my internship year. And over the course of the next 5 years, as I built this organization nationally to really address women, peace and security, women's inclusion, health access and equity, I continued to work as a physician. And I continued to work as a physician because it created a very predictable, understandable trust dynamic with the community. They needed to come to me for medical care, and it created a space where I could have conversations with them about belief systems, about ideas, about women's agency, about that they otherwise wouldn't have necessarily opened the door for. And it was really, really important. And I don't often quote French colonial generals, but Marshal Lotley's line that a good doctor is worth a battalion of soldiers in pacifying a population is one that I actually think holds a lot of truth. It's disturbingly insightful, and it reveals what many of our governments have forgotten, which is health systems build legitimacy. Now, non-state actors know this very well. They continue to use health access and access to food security, et cetera, to really ingratiate themselves with populations, and it's been incredibly effective, particularly if it's, to Anita's points, people-centered, community-anchored, equity-driven, or the perception of equity-driven. They end up being incredibly resilient and sought-after partners in crisis. Now, this can also be incredibly positive. I mean, we saw in South India where strong primary care and female-led community health networks really enabled one of the world's most effective early COVID responses. And we've seen a huge amount, I think, of recognition that the care economy isn't just about fairness or equity, but it's just actually a very smart financial investment. There's been some studies out of countries like Canada, where every $1 invested in early childhood care will return, $6 to $8 in long-term health and productivity gains. But it does bring me back to, I think, what our kind of central thesis is, which is we've heard a lot about how a well-functioning health system is a frontline climate adaptation tool. And, I think history would argue it is so much more. Greater access to healthcare for women and children means they're more likely to survive climate shocks and access early warning systems, yes. But it also means they are much more likely to make proactive decisions about nutrition, fertility, education, economic opportunity. They're more likely to try things like entrepreneurship. They're more likely to engage in public office. And we've seen that time and again, but ultimately, I think when we talk about resilience, when we talk about climate adaptation, when we talk about the potential for health to really be a bridge there, it's looking at what do people currently think about healthcare? What are those resistance? What are they currently resisting? And how do we engage there instead of kind of just throwing data or throwing some very health or climate specific language at them? How do we actually speak to people in a language that they're comfortable with, that they understand, and about the issues that they really care about?
Fantastic. Thank you. And Anita, we're delighted to see you and have you back. We fixed the technical issue. I want then to move to a second question, which is, and you've touched on it a bit, I think, each of you, and that is the cost of doing this is often cited as a barrier to intervening, whether it's systemic intervention or very specific interventions. And I'd love to hear each of your perspectives literally on the cost. That is, A, is it an excuse? B, have you seen financing strategies or best buys that could convince even the skeptics and bring these frameworks to life? In other words, how do we make the investment case, and how do we make it across sectors and systems, especially, and someone touched on this yesterday, when the benefits are often long-term? And so, and the views are often, the desire for outcome is often short-term, and therefore there's a timeline disconnect. So let's talk about the money, if we can, and the financing strategies. Who would like to go first?
Happy to kick off.
Okay.
Our commission several years ago really looked at this because there was this notion that investing in healthcare was this black box, and that countries never got that investment back. And to my point 5 seconds ago about hitting people with data, we built a whole, kind of binder full of data that said actually investing in healthcare is really effective, and it's actually one of the best things you can do for your bottom line. And a lot of it didn't get picked up the way one would expect. People kind of continued to believe that investments in healthcare, to your point, Judy, were long-term things that didn't fit their 18 to 24-month timeline, where they really need to be able to go back to their constituents and say, look at what we delivered for you. And so we've learned from that a few things. Number one, the best kind of best buys in financing that I've seen are ones that look across public and private partners. So they don't necessarily rely on one group. And what I mean by that is both philanthropy and private capital can really help try riskier things, and they can attempt different things. And then you can leverage and partner with government to really scale that. And so we've been really looking had a lot of kind of concessional financing and blended financing to really be able to drive some of the newer initiatives or newer ideas. I would say it does put us in a risk where we get into kind of pilot fatigue, where, you know, we pilot something and it's great, and then people are like, oh wait, to actually scale this, it would be exorbitantly expensive. And so really working in partnership with government at the beginning and placing technical expertise in government has actually been incredibly important. So how do you both get more resources for the issues you care about, but how do you more efficiently spend what you do have? And there's been some really excellent examples of how you can kind of finance in an integrated way, you know, that really reflects reality. So investing in care, education, climate resilience, and health together. Uruguay's care infrastructure law is an excellent example. It was backed by a coalition of ministers, and it's delivered both kind of economic returns, higher women's labor participation. It was just smart economics in action. I think the other thing I would mention here is how often, or two things I'd mention. One is how important local social networks and institutions are. So in Somalia, community-based health insurance schemes have worked really well because they're embedded in social networks and religious institutions. They're trusted, they're seen as responsive by the community, they're relatively resilient given the context. And I think much of our global health financing or global climate financing can often be really at that global kind of opaque level. And in many communities and countries, really working in close partnership with whoever the power brokers in that particular context and community are is critically important. I will say we do need to rethink who controls capital. Local groups, particularly women's groups, often know what's needed. They can't access financing in a debt equitable way. So moving from kind of top-down grants to trust-based funding models like participatory grant making can close that gap if you're working in the philanthropic space. And working in the private sector space, really asking ourselves why such few resources go to local agents and go to local entrepreneurs and go to local economic leaders, as well as, in particular, women economic leaders. And we've kind of been excited by, and I think something that's really exciting for this intersection in particular, is an increased, at least private sector interest in the intersection of health and climate because of AI. So there's a huge amount of interest in investing in AI for maternal care or climate forecasting, things that are kind of cross-sectoral by design and deliver outcomes for both health and agriculture or health and education. And I think we really need to embrace that and have conversations with the private sector more and kind of bring them into the conversation more so we can help them find some best buys to invest in that we can partner with.
I think that's the last point in particular is one of the strong ambitions of the Roadmap Commission, because I think we understand very clearly both that's where the resources are often the greatest. And importantly, that's where the sustainability may be the greatest, because there are goods and services, there are business models here that can work for everyone's benefit to sustain the efforts that often philanthropy and government leave after they've made the good beginning effort. Anita, you have your microphone off, so jump in.
Yeah, thanks. And I really appreciate Alaa's points about public-private partnership and the role of AI. I just wanted to add a little bit of a framework that we use in working with communities around some of this resource alignment and nesting and how to connect dots across sectors, mostly working across government agencies, but often with, private sector entities as well. And one of the things that we kind of try and press on, which I think gets to this idea of multiple benefits, co-benefits, is how to kind of think about braiding, linking, shedding, and shifting, essentially. And so working with community leaders, looking at these outcomes, in this case, well-being, what that fundamentally looks like, and then thinking about ways that we might braid funding to share or pull resources that can realize shared well-being benefits. creating better coordination around partnerships. One of the reasons I'm appreciative that we're talking about these other frameworks today is because they're taking up a lot of real estate and community conversations. So there's already a sustainability conversation happening. And oh, by the way, in parallel, there's a well-being conversation. And oh, by the way, in parallel, there's a resilience conversation, so on and so forth. And so we need to start doing that more thoughtfully. The idea of shedding and shifting also has been critical, at least in some of our work, to create some efficiencies, because often we have a wrong door problem in terms of which agency is holding the resources or leading on the resources to execute on a particular outcome. And it's been sitting in that agency or that department or that ministry for years and years and years, just because culturally people thought it made sense or somebody held on to it tightly. And so going through that process of trying to sunset things that are not working, where's the best possible use and impact, and then shifting things potentially across programs where the capacities and capabilities actually are, is a critical process. This can be very labor intensive for sure, but if we're going to make good on tying these frameworks together in something single and parsimonious, it's part and parcel of that, at least in my experience. One quick just comment on some of the frameworks that we are sharing with you today, and I'm happy to share this after the conversation. All of these things go together in my mind. So fundamentally, what I might offer is that the well-being and thriving is certainly the kind of end goal aim of a society that cares and produces, whatever that means in terms of production. Resilience and systemic resilience is a necessary feature and characteristic of those well-being kinds of economy or well-being society outcomes. Equity is a prerequisite and a centering goal for all of it. So there's a way to, I think, connect the dots that we have to think about when we're talking about resource mobilization. And that means that all of the sectors that we talked about yesterday have to kind of shed some cultural notions that live in their sector in order to contribute to the whole. And so this is kind of an important process note, but it's also an important philosophical note. And I would just commend us to think about what that will take over the course of the next year or two to do that. That's really the hard work that I've observed.
Fatimah, would you like to jump in to this question?
I find my mute button. Yeah, so the case for care economies, more specifically, in terms of investment, is a very strong one. There has been enough research that has been done by feminist economists, various institutions such as the ILO, various UN agencies and others, demonstrating that investing in a care economy specifically, would, especially with a focus on the redistribution of women's unpaid care labor, yields returns for the economy. And before I continue, I do want to just put in a note of caution here around the instrumentalization of what is essentially should be a rights-based argument using economic framework to justify them. And the reason why is because whenever we apply sort of a dollar justification for why something should happen that's rights-based, there is another researcher somewhere else who could create a dollar justification for why the opposite should happen. And I think we always have to be very cognizant of that. And throughout my career, I have found that relying on the dollar amount, whilst it can shift certain policymakers in certain areas, ultimately can also be very problematic for the longer term goals. And this speaks a little bit to the concern you raised earlier, Judith, about the positioning that a lot of policymakers have when they come in, that they have maybe 5 years, 6 years to deliver, and therefore convincing for a much longer term goal is problematic. And again, this links into this issue of narrative shifts. But ultimately, it is about recognizing that an investment in a care economy or a care society is an investment in social infrastructure, rather than simply seeing it as an expenditure or even as consumption. So again, we've got a case of narrative shifting needing to happen in order for that resource allocation to actually start to take place. So, for example, the ILO did some research a little while back that showed that doubling care economy investment could lead to hundreds of millions of jobs globally. And again, the question we must ask on the back of that would then be, what kind of jobs? Are they decent jobs? Are they dignified jobs? Otherwise, we would be replicating the issues that the care economy would be trying to solve if these questions were not taken into account. There's other research by the UK Women's Budget Group and the International Trade Union Confederation who have also posited that public investment in care is more effective in reducing public deficits and debt than austerity policies. And austerity policies, as we know, are often the go-to, whether it's in the global north or the global south, when it comes to reducing public deficits. And when we periodically hit the recessions that we always seem to hit every 10 to 15 years. Now, the challenge, of course, is convincing policymakers, and hearing Alaa talk about, the challenges in doing just that, despite some very strong demonstrable evidence, resonates very deeply with me, because it feels that has been the constant battle over the last 25 years of my career, to be honest with you. And, to do so would require a radical rethink in where that investment comes from as well. So I hear the call for increase, public-private partnerships, and I do understand where that comes from. However, I would also put a note of caution around that. One, because public-private partnerships have not been successful everywhere, and there is a growing case and evidence that, in fact, they can be problematic for long-term provision of whatever public service it is you are trying to deliver, for a variety of reasons. But as somebody who works particularly on the African continent, as an African myself, the question of public-private partnerships does raise some red flags, particularly when it comes to the creation of institutions and systems such as a healthcare system that is effectively still in gestation and has yet to be birthed at a universal level. Because what you're having is a privatized positioning to a large extent. And this directly contradicts the earlier position I raised regarding moving our understanding of healthcare away from being an onus on individuals or units such as families, and making it more of a collective positioning. I was really appreciating Alaa bringing up the Uruguay care system. I will speak about that a little bit later as well. But they had a very rights-based positioning within their approach to the work. And they did work with markets, etc. But I think what was really critical about that system is that the duty holder was very much the state. And that was a key part of the understanding of how this care system would work. Now, there is another source of financing that hasn't been mentioned so far, and needs to be, and that's simply taxation and the need for more global progressive taxation regimes. This is as relevant to the global north as it is to the global south, even if the manifestations are different. So in parts of Europe, now there is an increasing debate on wealth taxes. And here in the UK, it's been a big deal over the last few weeks in particular. Whereas in Africa, curbing the loss of illicit financial flows from the continent, when we're talking about billions, each year, and ensuring that multilateral corporations are unable to use the many tax loopholes that they currently have, is a major battle that's being fought around debt and debt servicing, but very critically, revenue and economic policy-making sovereignty. So even if we were able to get policymakers to agree to some of these positions and the evidence that supports why this is needed, they are currently completely unable to do so, because it's not just so much that the revenue is not there, because they do not have the kind of progressive taxation needed in order to bring in independent revenue, but actually there's an issue of policymaking sovereignty that surrounds that. And that is just as important if we are to get the type of care societies and the type of care economies that we want, that will be genuinely equitable and just in the longer term.
These are extraordinarily important comments, with all of the caveats in particular. And it allows me to both integrate a few of the questions that have come in the chat, and the next question that I was going to ask, and that is, if we are to engage the private sector most productively, and if we are to utilize government actors most effectively, what kinds of arrangements are needed to support this integration? because ultimately we can't make this happen alone, whoever the alone is. And private capital and private sector actors and government capital and government sector actors are essential to the systems level approaches that you're promoting. How do we do that? And if you have successful, tangible examples, that would be amazing. But if not, even a theoretical conceptual framework that we could embrace, and begin to think through would be enormously helpful. Who would like to jump in? Alaa.
I'm happy to jump in. I also saw some of the comments and questions in the chat, so I'll incorporate some of them here. But I wholeheartedly agree that public sector, ideally, a strong government should be able to invest in those goods, primary healthcare, education, water access, et cetera. In an ideal world. I come from a country that has, I don't know, right now, 3 governments and has been in conflict for decades. And the government is not competent enough to provide those services. And so then a question has to be asked, do countries that are in fragility or in conflict, which is a quarter of the world's population at minimum, do people who are displaced, are they not deserving of services? And if we want to look at how do we actually create the opportunity for people around the world, not just in places with functioning, effective governments, and to Fatimah's point, solid tax codes, and et cetera, or strong national resources that can help them facilitate and support these services. So how do we, I don't think it's an either or is what I'm trying to say, but if we're thinking about how do we scale solutions quickly and sustainably, particularly in the face of accelerating climate threats, public financing alone just isn't enough. And we're seeing that now. We're moving from an aid to investment narrative very publicly, where our leading donors are saying, hey, we can't actually finance this in many countries around the world. We need alternative solutions. And frankly, they can't finance it in their own countries right now, which is why this push is coming. So, I do think public-private partnerships that are built on equity and accountability and long-term outcomes are really important, Judith. I think the point isn't just to de-risk investment, but it's to align it with public good. So for example, in Ghana, you have partnerships between the government and telecom companies that have expanded access to digital health services in climate vulnerable regions and to digital public infrastructure. And that's really important because it means more people can, bank, more people have access to capital. Really opening that space ends up providing a lot more opportunity for so many people. You have in Jordan private solar providers who are now powering public hospitals. You have, in Nigeria, LifeBank, a women-led health tech company, uses drones and digital platforms to really deliver blood and oxygen to remote hospitals. It saved thousands of lives where public infrastructure has failed to reach. In Bangladesh, BRAC, which is, everyone's favorite partner, has partnered with solar energy companies to electrify rural health clinics, ensuring they can operate in floods and heat waves. I mean, there's a lot of examples where the private sector isn't just filling gaps, but it's innovating in ways that public systems often can't move fast enough to do or have other things in their list of priorities. It's a gap filler, but it's a necessary one for people whose lives are being saved. Now, I will say the models work. I think the models work most effectively when there are clear rules of engagement. So local hiring, recognition of what the environmental impact is. To Fatimah's point, really looking at gender equity and kind of and I wouldn't say I have a thing about rights-based arguments in the sense that we don't all have the same understanding of rights or values. And so that has to be very locally contextualized. So local partnership and local values and understanding what those are rather than the imposition of, I think is really important. And then of course, affordability, because when they're done right, they unlock innovation, they drive efficiency, they accelerate the reach of services that would have otherwise taken decades to build through public budgets alone. So yes, public financing is foundational, but without strategic partnerships, I think we'll continue to under-deliver on the scale and urgency that this moment demands. And I will say we have not yet seen a one-size-fits-all. We have not seen, in most times, your most effective partnerships are really where there is both a business need for the company or a business incentive and a public need or incentive from the local community or government. And that partnership is oftentimes built over time. We haven't seen an excellent, hey, this is the checkbox exercise you must do to have a successful partnership. We don't necessarily have that. I think we really look at, is it locally owned? Are they looking at cross-sectoral impact? And is it realistically affordable for the community it's in?
One of our commissioners is saying that often when the actions are regulated by frameworks, regardless of what those frameworks are, they don't protect social health and environmental issues. So they have an energy charter, for example. The European Energy Charter was one example. But how then do you convince these framework actors who are pan-governmental to take these elements into account?
That's incredibly true. It's also true for public sector, though. And so I think we have to be, again, it's not an either or. That's true for public sector, for nonprofit sector. We might have agreements and frameworks, but very often they don't. And many of them claim to protect social health and environmental issues and fall short. And so I think across the board, there needs to be an accountability. And how do we build that? And is that part of, I don't necessarily think the roadmap, but is it part of building out those partnerships and looking at how do you actually secure some of that financing? So for a lot of your public-private partnerships, you are looking at an element of public financing or financing that is that has some level of government oversight, particularly through some of your development finance institutions, through your sovereign wealth funds. Is there a way where you make that financing contingent on some of these protections? But right now, I would argue we claim to have that across the board in most areas, and in many parts. I mean, even the most basic of safeguarding children, we fall short on. So I think that's something that we need to do across the board, not simply for the intersection of health and climate.
Anybody else want to jump in on private actors or government actors and how we can be more creative in working with them?
Fatimah? Yes, yeah, I'd love to. And I'd like to pick up here on the Uruguay example. Now, it's really important to note that I completely agree that there is no one size fits all. And also that we haven't actually got what we'd call perfect examples yet. I mean, this is the reality of it. You know, even the two that I'm about to mention, are constantly faced with challenges, and that is the ongoing reality. But if we look at Uruguay, the care agenda in Latin America, first of all, it's very important to sort of note the amount of work that has been put into that space, largely by feminist economists, feminist activists, and that is a critical underpinning of why that has been successful to a certain degree in the two case studies I'm about to mention. And they've made it about going beyond sort of the visibility and recognizing unpaid care contributions to the economy and to society by proposing these concrete policies for redistribution of care between men, women, between households and the society more broadly. And the Uruguay care system has actually got a much longer name, but we'll just keep it at that. Its aim is to implement and coordinate care policies for all those with care needs, notably young children, the elderly, those living with disabilities. And it is based very much on a principle of co-responsibility for the provision of quality care that is shared with the state. So here we had multiple actors after years of activism and advocacy. Let's note it's not something that just sprung out of anywhere. So this issue of it being localized, this question of it being contextualized is absolutely critical in order for it to even emerge and be successful at a national level like this. But as I mentioned earlier, the state is positioned as the principal rights duty bearer, and the community, the market, families, and women all play a role within that as citizens of the state. So that relationship between the citizen and the state and the citizen-state compact is strengthened as a part of that process. Now, one of the aspects that also made it quite strong is they created an NGO, essentially, to help with the management of the system. And this sat very firmly within the ministry where it was being curated and implemented. And again, the activists and the local actors who were part of that were critical. And this comes back to this question of sort of, the public and the private financing. It's not so much about an either or one or the other. In many ways, it is about the relationship between the two. And my earlier point regarding, for example, healthcare systems in many African countries not being birthed into being as essentially privatized healthcare systems is because of the lack of regulation that would come with that. Largely. And this is about the relationship between the state and the private actors. And public financing and private financing aside. It's more to do with whether or not you end up with an economy more broadly, and then systems within that, whether they're healthcare systems or education systems, that become beholden to corporate power. And that is a very critical concern, particularly for countries that are currently going through what we call the earlier developmental stages that other, high-income countries have already been through, because many of those high-income countries did not deliver those same institutions without a very high level of state responsibility, oversight, and regulation on their part. So we shouldn't expect the same of those countries who are now trying to essentially emerge with those systems in the first place. The other care example I want to give is the Bogota care system. And so this is a city level example. And, essentially in response, again, to activism around the issue of gendered care work. And here we have sort of about 3.5 million out of the 4 million women in the city essentially carry out unpaid care work. So the government developed the system, and the aim is to bring the city and its services to women who are unable to travel from home. And it's considered pretty much a radical ease of access model. It requires reorganization of the city, how it's planned, how it operates, and it centers those largely women, whose lives and work had previously been invisible, but again, who had been socially reproducing this society and allowing the society to even get up in the morning and get on and do what it does. And it prioritizes the well-being of both the caregivers and the cared for. And that's absolutely critical, allowing women and unpaid carers more broadly to take care of themselves, knowing that, those who they also care for are receiving the best possible care. It's very interesting that Bogota was the first Latin American city to also declare a climate emergency. And you can see in the way they have made this very much a structural issue in terms of the replanning of the city, how they have gone beyond, again, that compartmentalization of health and care into sort of one silo, and I think more holistically and broadly across the structural inequality that had been in place as a result of unpaid care, and by centering care as a part of that society's success. And I'll
Very
stop there.
strong point.
There's more, and we can come back to a few more issues later.
I'm integrating several questions from our chat, so I am over time in the panel, but I have one more question that I would like to ask you, and then I'll go back to the questions in the chat, because all of the sessions, speakers have talked about narratives, how we really move from abstract frameworks to narratives that motivate action, and the likely need that we're going to need different kinds of narratives for different kinds of audiences, that a narrative for policymakers may be different from the general public, et cetera, et cetera. I think each of the three of you has really strong data on and insights on the use of narrative. And I think it would be amazing for the group here to hear you and be able to understand them. So Anita, I'm going to start with you. The data from the RAND Metropolitan Group report are pretty extraordinary and very useful to this conversation.
Yeah, happy to. And one thing that I always sort of pick up in these conversations, having done this a lot, to going back to the theme of health as kind of an entry point and a bridge between sectors and systems, is how quickly we drift, and we all do it, into kind of either a healthcare conversation as opposed to a health conversation, and a service conversation as opposed to a relationship conversation. And this has been true also in the well-being space. This morning, I joined a readout on the Global Flourishing Study. I know a lot of people involved with that. But a lot of the conversation in that discussion remains about kind of individual outcomes-based well-being, subjective well-being, as opposed to collective well-being, which I think is a greater framework for how we think about people and planet and the intersection of health and climate and the interdependencies among systems. So I just wanted to name that, and happy to talk offline about it. Judith mentioned this work that we've done between RAND and Metropolitan Group. Metropolitan Group is a global social change organization. So the way that we come at narrative is not in a kind of health communications way, but to actually delve deep into the root frames that guide our values and the ways that we interpret the world. And so when we try and move communities, in this case, towards a greater appreciation of collective well-being, which is kind of the aim in some of the work that I do, so that we can get policymakers and media and grassroots organizations working coherently, what we have found essentially is that this notion of relationship is kind of critical to unpack. So we've actually done some work on the frame level of that, where we're talking about words that we've talked about today: healthcare, dignity, purpose, and meaning. And where we find synergy actually between the public and private sector is around issues of purpose and connection. Because business leaders understand that this is critical to aspects of innovation and productivity. They're not going to completely change who they are as private sector leaders. And the idea that they would, I think we won't get them there. But public sector also has to think about reimagining government. And what that means in terms of investment over time, multi-generationally in social infrastructure, so that social connection and purpose is actually the core, not just this sort of economy plus kind of notion that sometimes pervades well-being today, which is like, let's tack on a few measures with GDP and then call it a day. So we have found some points of connection, and some of these materials are really available. The other thing that we do is that we walk through a process with communities about what they believe about themselves. It doesn't mean that it's true. We know that that's fraught with all sorts of mythologies, but starting with what communities believe about themselves, just like in psychology, helps us understand then what are the constructs and schema and frames that we then have to reorient and work. And two themes have emerged, at least in some of the communities that we've worked in. People really believe kind of some essence around work, not just the formal work, but sort of contributions to work ethic, work connection, work as a means of dignity. And they also believe in this sort of sub-community level of connection, right? Whether that's neighborhood pride in the United States or some other construct in other countries. And that becomes actually the entry point by which we can then have a conversation about health and collective well-being. The minute we start talking about health, then health department or medical care or whatever takes over the conversation. The minute we start talking about economic development, those relevant departments take over. And so starting with kind of stories about the community that people can wrap their arms around often is a place where we can change that frame. And allow it to be a little stickier than what we've seen over the last few years. Last point, when we've seen places that have done well-being budgets, countries and the like, and I've had the privilege of working with some of them, when the politics change, then all of a sudden they say, well, what were we doing about this whole well-being thing? We should be about jobs. So that means that we actually haven't stuck the landing in terms of our narrative shift or our value shift or our appreciation of relationship rather than service. And so that's why going deep and spending a lot of time on aligning some of these frameworks and thinking about narrative is so critical, because it's gone in a flash. And so I really resonate with the earlier points about dollars and cents. It can sound really good. I work at a policy organization, but ultimately it's actually not the sticky thing. The sticky thing is that emotional substrate. So happy to share more, but I'll turn it back over to the other panelists. Yeah.
That's a great lead into Alaa to talk about the role of faith-based communities and what you found from the Lancet Georgetown Commission.
Oh, I'm happy to. So I've spoken a little bit about the organization I started when I was younger, the Voice of Libyan Women. And our focus in Revolution Libya was really on women's inclusion and leadership, particularly in security and public office, et cetera. And I remember in the first months, I'm sure many of you have been in the same boat, where the people who showed up were the same faces. It was always the same women were coming, the same families that were already quite supportive of women's agency. And I was like, how do we get other people? And I was talking with my grandpa, who is like your stereotypical old school, like, grandpa. He just was not vibing with anything I was selling. And I asked him, okay, so why aren't you supportive of my cousins coming and things like that? And he said, Alaa, explain to me exactly what you're doing. And I did. I used like CEDAW frameworks and 1325 and the UN Charter for Human Rights. And he was like, what are you even? And his response has stuck with me ever since, because I said, listen, your support culturally is very important. people see your support as validity, credibility for me doing the work I'm doing in this country. And he said, you are going to people and telling them everything they believe, everything they have taught their children, everything they have raised themselves in is wrong. You are implying that they do not care for and love their children. You are implying that the way I raised my daughters was ignorant, was flawed. Like it was such a personalization of something I was trying to intellectualize. And it taught me, that experience has taught me more than anything else. And so I'm currently serving as a commissioner for the Lancet Commission on Faith, Trust, and Health. And it's been incredible to see what I perceived as kind of an individual lived experience or exclusive to, certain geographies or as really universal. To Anita's point, what stories people tell themselves and really shifting that is who gets to re-narrate it, who has the credibility and unity to be a trusted messenger. It really doesn't matter how strong the investment case is. In full transparency, it doesn't matter how many UN charters or frameworks we bring into the table. A huge part of it really is that relationship. How much do I trust you? And how much do I see myself in what you're saying? And how much are you respecting the values I also bring to the table? And there's some excellent examples of this. In Bangladesh, imams actually integrated climate and health resilience into their Friday sermons. There was no policy documents. They really said, listen, they connected it to the Quran. So Quranic stories of stewardship and balance, and that's what worked. In North Africa, women talk about care not as an economic burden but as an intergenerational faith-anchored responsibility. In Argentina, a huge impetus for a lot of the feminist movement there, a huge way that they've been able to mobilize more energy and action has been through faith connection. And even for myself with the Voice of Libyan Women, after that conversation with my grandfather, we did the Noor campaign, which has since been replicated in over 40 countries. And it used faith. We sat down with faith leaders and actors in the ministry who previously had told us, listen, you should not be speaking about this at all. And we got them to validate some of the Quranic ayahs we were using. And people simply seeing that logo on it meant that our message suddenly was so much more salient. We were allowed into every school and every workplace by national decree because of that partnership and able to reach so many more people. So I think recognizing in any country, and I would argue this is as true in the United States as it is in Libya. I mean, the money still says, "In God we trust" on it, right? So I think in any country, recognizing the incredible power, positive and potentially positive, potentially negative, of faith leadership, and particularly organized religion as an economic and political tool, I think is an incredibly important, and looking at how we're engaging there. I will add really quickly, just because it's come up in already, this kind of co-benefit language matters. I mean, faith is an obvious one in many ways for the intersection of climate and health, but I would say it also needs to be done for policymakers and investors. I loved Anita's point about we need corporate to kind of reimagine governance. We need governance to reimagine governance, frankly. We need everybody to reimagine corporate. The private sector has so much economic and political and narrative power at this point that it really can't be a prioritization of investor protection or a prioritization of commercial need. We actually do need a new generation of private sector partnerships, and we need it to be governed not by the outdated investment treaties or metrics or things that we have now, but instead, the same way we're telling new stories in community, we need to be doing that within government and private sector. We need to be forcing a different kind of accountability. And I'll end by saying Fatimah's point about none of this is either or. It really is about the relationship. I think all of this narrative, health, climate, partnership, and public and private, all of it is not just about the presence of, but it's about the design of these partnerships and the power dynamics within those partnerships. And I think narrative is an excellent way where you can see that power dynamic really come through. But it's something I think we need to work on across the board for this to really be more salient.
And as we heard from Kelly yesterday, a systems approach really is able to understand all of the variables, organize them in a way, and power dynamics are part of the fluidity, the juice that makes an otherwise static system not a very useful framework. So what we're going to try to do is both lay out the static system and then talk about all of these dynamic elements that move the system around. And you all three have done a great job of articulating some of them.
And Judy, one thing I will say about power dynamics is we often ignore that people hold power in different ways and at different points. So in certain rooms, I will be much more powerful. That is my sphere of power, right? And in certain rooms, you will be. And sometimes when we look at the dynamic by which we're trying to look at narrative, we oftentimes forget who is the power broker within that space. And we think about some of our traditional power brokers. Okay, well, we're going to go through these institutions, or we'll go through this government partner, or we underestimate the fact that it actually might be, you know, the local teachers union that has the most power in that space. And particularly not just to shift narrative, but to shift policy. And so I think really recognizing different spheres of power and how they show up will be really important, because behavioral change is hard. It's near impossible, and it takes a very long time. And so all hands on deck, but working through both traditional and more formal structures, I think will be really important.
Again, workshop 2, we're moving to the how. Fatimah, you've had a lot of experience in developing narratives and the content and the value systems that undergird those narratives. I know you've been very thoughtful about. Can you give us some examples?
Yes, of course. So I heard that in some of the conversations earlier, there was some talk of the importance of language and of how we communicate this across. And, you know, with NAWI, the macroeconomics collective that I'm a part of, you know, our advocacy really has to start with narrative shifting. Because if we don't do that, what we realize is that you might have a success if you're to find, for example, the right policymaker who, you know, is in agreement, or maybe even just wants a legacy before he or she exits the space. But it will hold nothing in terms of further implementation or even survival beyond that term. And narrative shifting is absolutely critical for that. And language has a critical role to play in this. I'd mentioned earlier, for example, that when talking about investment in care, you know, the language needs to use that of investment in social infrastructure as opposed to budgetary expenditure or consumption. Similarly, I've done a lot of work on feminist trade, gender and trade over the years. And when I talk about the role that women play in the economy as, you know, sort of workers, unpaid carers, informal workers, laborers, one thing I will never do is refer to them as consumers of public services. I will always refer to them as users of public services. And because the consumers of public services immediately creates the resonance of a commodified product. And that is problematic. And so the way we use language is critical. Accessibility of language is very important. You know, at NAWI, we are really engaged with trying to ensure that the language of macroeconomics is something that everybody understands. And it's critical because actually everybody speaks macroeconomics every single day. So we have a booklet, for example, that we call Macroeconomics 101, and it starts with the price of garlic. So the conversation that you have in the market with your neighbor when you try to understand why the price of garlic suddenly jumped on the back of some exogenous shock that you maybe don't understand, but you're having that conversation and you understand what that's going to mean for you at the household level, you understand what that's going to mean for you at the community level. And there are ways in which this can be done. So the way we utilize language in terms of communicating this is very, very important. But in terms of the African continent in particular, which is where I do most of my work, and again, returning to care societies, you know, one of the things that we need to do in that regard is to actually bring the conversation back down to a contextual level. So speaking to what we spoke to earlier, care as a framework is something that has been designed external to the African continent and has been rolled out in different places. And it's a fantastic framework of the 3 Rs that we know of, you know, recognize, reduce, redistribute, and remunerate. But ultimately, there is a lot of work that needs to be done in understanding what this means for Africa as a continent and African societies within Africa more broadly as part of that. So again, taking the time to write those narratives and to write it in a way that makes sense. So several of our feminist economists and feminist activists, for example, have started talking about care and indeed frameworks for public services that center care through the language of Ubuntu. So this is a framework and a term that is, very well known on the continent, but more broadly can actually be found in other parts of the world as well, particularly, among indigenous societies, that speaks to the importance of the community as sustainers of households, communities, and the earth. Challenging, again, that current, unequal social division of care and responsibility that has emerged on the back of atomization and individualization through modernity. And, this issue of shifting the values away from the onus on the individual is perhaps, I would argue, one of the biggest narratives that we currently have. It seems consistently, as we have industrialized societies and as we have modernized societies, that is a continuous thread. And no matter where you go across high-income countries, you see that representing. How you challenge that as a continent that is emerging, such as Africa, into a phase which we hope will lead to its eventual industrialization is quite critical. And you can't separate this from the question of how Africa then addresses the issue of growth, for example. So there's a whole narrative shift that needs to happen around growth. We talk a lot about, the importance of growth and the importance of GDP growth in particular, which has been criticized as a metric of development enough times. I think I don't need to necessarily do that here. And yet still, economic dogma puts us in a place where we are chasing it. So one of the huge challenges we've got at the moment on the continent is to try and create a discussion that shifts the narrative on what growth means for Africa as a continent, which does still need to grow, whilst maintaining the fact that, for example, all of the planetary boundaries that have been blown so far are not the responsibility of the African continent. They have been the responsibility of the global north primarily, as a result of global northern growth. And so we do have a right to grow as a continent and as our individual countries. But do we follow a similar trajectory?
I'm going to cut you off. This is an incredible piece of the conversation.
Okay. Let me just wrap it up very quickly.
Please.
Let me just wrap it up on that growthism point. We have to challenge the idea that growth, first of all, is endless. And this is critical for climate action, as we know. So unless you take a new narrative of what growth means, the extent to which you grow, how you grow, but very critically, why you're growing, and the kind of society you want to create on the back of that growth, we will end up with developing nations and developing continents essentially replicating some of the flaws and failures that have led us to this climate crisis in the first place. And the Earth simply, as well as the people, those of us who are on the Earth, cannot afford that.
Let me underline for you and for those participating in the workshop today that this point is the goal of the fourth workshop that we will be holding. So to the questions that I see from the audience, as well as to the really important critical points that Fatimah was making. We agree completely, Fatimah, with that perspective, and therefore are constructing our final workshop to ask the question, how could the Global South leapfrog over all of the high growth, climate hurting mistakes that the global north has made and created in a way this climate crisis in ways that are socially, economically, and health productive, as well as overall producing a kind of non-trade-off between planet and person. So we're very excited actually to be tackling that question, and we hope you and lots of others will come back. Do I have one more minute or do I have to stop, Michelle? We have great questions.
Yeah, you have another minute, Judy, maybe wrap up in 2.
Okay. There was a specific question again, because people were quite interested, and I have several, on this discussion of multiple financial approaches. But one question is really about how could we design a balanced approach to taxation and subsidies that would incentivize most effectively involvement in climate health actions? That is there as one piece of this approach, a framework that could use both taxation and tools as both taxation and subsidies as tools for promoting engagement. And how could we ensure, if we did that, that these financial mechanisms would lead to equitable and sustainable solutions? So that's a question somebody could quickly answer. And or I definitely want to go to a lightning round question, because we are going to end our conversation. And someone might want to answer the question that I just raised in the chat. But your expertise has been extraordinary, and we've all witnessed it. And so we're going into workshop 2, which is the how. And in a sentence or two, maybe each of you could indicate a key element from the framework you've been describing that must be an essential element of the how, that we shouldn't overlook as we're designing workshop 2. Anita?
Sure, I'll start. I would say the idea of multiple benefits to nurture something rather than reduce deficits is a key part of well-being. And then I would just encourage us to think holistically across these frameworks, because they are colliding in communities. And so the narrative change, the measurement change, which we didn't get to talk about, and the investment alignment is very much, at least in my experience, core to where communities are getting stuck. And there's going to be probably a new framework in a year. And so thinking ahead is really important. So my 2 points. Thanks.
Great. Fatimah?
Yes, it's a tough one to pick out, but if I had to, I would say the most critical thing, really, particularly in cases where we have seen that activism and advocacy over years has led to some kind of a sea change or some kind of a catalyst that has led to the emergence, even if it's still struggling, of, for example, a care economy or a care society, is the continued inclusion of those activists and advocates who were part of the initial process. And that can't be overstated, because it's very easy for it to be gobbled up and for those individuals and groups to then be pushed out. It's about the continued recontextualization of the situation, but also the importance of ensuring that those voices continue to influence whatever has been created from that point onwards. Otherwise, not only is it likely to eventually peter out, it could morph into something that then starts to contravene or contradict what was originally planned.
We heard in the earlier panel the importance of everyone having access to the data, so that whomever is using them and whomever is framing them using their own narratives at least is using the same evidence base, even though they're communicating it potentially differently to their different audiences. We haven't talked a lot about Indigenous knowledge, but we on the Commission have been discussing that quite a lot as well. Alaa, you have the last word.
I'm actually just going to pick off right where Fatimah left off. I ultimately think any conversation about health or climate or economic opportunity is all about power. I think inherently about power. And I think the how starts with who we trust and who we are willing to center. I don't think systems change, or any change starts with frameworks. It begins with relationships. And so that does mean investing in the people and institutions that are already holding the line: midwives delivering care during floods, community health workers with no support, youth networks that are already mobilizing for clean air, faith leaders reframing climate action and health action as moral duties. So I think we drive change by funding them directly, by shifting power in a very tangible way, not just resources into their hands. And then I would add by holding every public and private sector actor accountable to the same question: are you building a future that's healthier and more fair and more resilient, or just more profitable? So I think for me, it's really funding transformative leadership and recognizing it already exists in the communities we're talking about.
Wonderful. Well, this has been an extraordinary panel, and I thank the three of you so much for this exciting conversation. I think we've learned a lot, and you've given us a lot of marching orders for how we continue to think about developing this roadmap. I want to turn this back now. Also, you've been a great audience, so let me thank the audience for the really good questions throughout these 2 days, and turn this over now to Howie Frumkin who will review for us and summarize, what a tough role, Howie, the workshop one conclusions and takeaways.